I was walking down the stairs and like just missed the step, and from there it just tumbled.
I'm sorry to hear that.
It hurts right here now.
Okay. Gently gonna feel along the thumb here. Okay. Index finger there is definitely showing some signs of swelling as well. Good. Does this feel about the same?
Mm-hmm.
And no difference here in any of the fingers. Thumb feels exactly the same.
Mm-hmm.
Good. Okay. And you can tell that this is sharp.
Yes.
Same sharpness. Good. And you can feel me touching your hair.
Yes.
Alright. So I do see some distension here. In here. In here. Okay. So we are right about medial there. Enough for me to see it.
Like about there.
Okay, okay, good. All right, Samantha, let's go ahead and get started. I know we've done a bit of your initial intake today as far as your vital signs and stuff, and your heart rate was just a little bit elevated, but obviously you've been in quite a bit of pain, so that is to be expected. Now, I was going over some notes that the medical assistant took as she did your intake, and it looks like you had a fall recently.
Yeah, I like slipped and fell on the stairs, and it hurts right here now.
Okay. The stairs. Are these the stairs at your house?
Mhm.
Okay. Okay. Just to do an initial pain assessment, about how much pain would you say you're in right now?
I'd say about like a 4 or 5.
So decent amount of pain, but not excruciating. Now, when was the onset of the injury? Did this happen yesterday, this morning?
Like 2 days ago.
2 days ago. Okay. So were you kind of trying to wait it out?
Yeah, a little bit.
Okay. All right. So fortunately, sometimes when you fall or you have an injury, the pain doesn't onset right away. It can take a couple of days. So it's good that you came in to let us have a look at it. All right. Now, just to ask you a couple questions about the scenario in itself. Were you like carrying anything up the stairs, down the stairs?
No, I was walking down the stairs and like just missed the step, and from there it just tumbled.
I'm sorry to hear that. Any other injuries besides the arm? Did you hit your head, or no loss of consciousness or anything?
No.
Okay. Was it a witnessed fall? Did anyone see you?
No, they were in the other room and didn't come in until I shouted.
Okay.
I tried catching myself with the sand and then...
So kind of braced yourself?
Mm-hmm.
Okay. All right. Have you done anything to mitigate any of the pain, like Tylenol, Aleve,
Yeah, I've taken some Tylenol and I put ice on it.
Do you feel like it helped at all?
A little bit.
All right. So I do notice just a little bit of swelling right off the bat. Obviously, I will do a physical assessment. Did you notice that there's been swelling that's kind of come and gone, or?
Yeah, it swelled up a little bit, and then once to put some ice on it, it went down, but still a little aggravated.
All right. Have you noticed any numbness of your fingers specifically? Any loss of sensation there?
Maybe like this one.
Okay. I want to look at that, make sure there's no nerve damage going on. Now, can you point to where the most painful pinpoint would be?
Like right here.
Okay, so definitely. Okay. And if we were to gauge kind of how far up the pain goes, would you say it's like the entirety of your hand, or?
No, I think it's just like from here and then like a little bit down, but for whatever reason it
Okay.
shot
So
up a little bit.
Medial, kind of at the joint there. So we'll say second extension and then down 3/4. Okay. All right. So definitely so far consistent with a fall where you've kind of braced yourself with your hand, which is a very natural reaction. Unfortunately, we go to put our hands down so that we don't hit our head. All right. So aside from maybe some loss of sensation could be due to the swelling, any kind of tingling sensation, like if your leg were to fall asleep and you start to feel static, anything like that?
No.
Have you noticed that it's particularly warm or cold to the touch?
Maybe a little warm, but not too bad.
Alright. And does the pain get worse when you do anything? So when you try to pick something up, when you're grabbing something?
I'm like trying to rotate.
Okay. So pain upon rotation. We'll definitely check your flexion and extension. We'll do some mobility testing as well. Now, I'm assuming you drove yourself here today. Did you have any trouble with that while you were driving?
I'm used to like doing
Okay.
tried doing it with my right hand instead of my left.
Are you right-handed?
No, I'm left,
Oh,
which makes this even
okay.
worse.
Okay. That's not good. So we will definitely try to see what we can do. Alright, left-handed. Okay. Any previous injuries to the area? Have you ever broken your fingers? Nothing like that. It's not like we re-injured anything. Alright, so we are going to go ahead and do a couple different things. I'm going to do a pain assessment, obviously. I'm going to test your mobility, see if there's any loss of range of motion, if you're having any issues with your dexterity. I'll have a look at your fingers. Definitely going to do some reflex testing, see if your reflexes are reacting normally. Maybe a bit of sensory just to rule out that numbness that you're having. I would guess it's probably just due to the swelling, which can be normal. And then I'll kind of assess whether or not I think you'll need a brace, which is more temporary. You can kind of take it on and off. Or if you'll need a cast, a temporary cast or a more permanent cast. So a brace, we'd like you to keep on for 23 hours a day. So really you would take it off when you shower and then you would put it back on for a certain amount of time, depending on how severe it is. Temporary cast is something that you would keep on for like a week or two, and then we could kind of reassess. It's more so just a splint to keep it immobile so that you're not re-injuring. And then obviously a more permanent cast is like the 6 or 8 week where you would have to have it on for quite a while. Okay. At this point I'm leaning either toward brace or cast. Temporary cast, I don't think you're going to need a permanent just because it doesn't appear broken or dislocated to me. You probably wouldn't have been able to drive yourself if it was broken. So let's go ahead and do our assessment now. So let me just set this aside. There's plenty of room here. So I'm going to ask you to come just a little bit closer for me if you can. Whatever's comfortable for you. I don't want you to overextend it in any way. All right, so I am going to start with just a pain response test. I want to see where exactly the area is. I don't want to hurt you, but it is important that we kind of isolate pain here, okay? So I'm going to overextend quite a bit. I'm going to start at the shoulder. So any pain or discomfort here at all? No tenderness or anything. Okay. So you come down the forearm, nothing here at the elbow. No. Outer elbow as well is fine. Okay. As we come down here.
It's right there.
Okay, I do start to feel some warmth for sure here. Okay. It's getting more painful as we come. Okay. Any more or less pain up here?
It's about the same there.
Alright. So I do feel some heat here for sure. Now if we do outer versus inner, so we'll say this is outer left, inner right. Any more pain here versus here? Is it less painful on the inner or about the same?
It's less painful on the inner right.
Alright. See a little bit of distension of the vein here, which is likely just excess blood flow trying to heal the area. So I'm just going to do some gentle palpation too. It's probably going to be just a little bit uncomfortable. If it's too painful, let me know. I'm just feeling around here. I want to see if I note any protrusion of the bone, looking for any obvious dislocation, which I don't think is present. Okay. Just gently going to feel along the thumb here. So I'm gonna just touch your fingers here individually. Does this finger hurt at all? No. Here? No. Here? Here?
It's not too bad.
Not too bad.
No, it doesn't.
Are you able to flip your hand at all? Does it hurt if you turn? No. Okay. So same thing here. We're gonna redo that pain assessment. So you have different structures of sensation on other sides of your arm. So any pain here at the shoulder?
No.
Down at the elbow? Coming down your arm here?
A little bit right there.
Okay, so I do feel again warmth here. I do notice some swelling here. So notice that there's a little bit of a dip here, and then we've got some swelling coming up towards the injury site. So just taking note of that. And as we come up the hand,
It's not so, like, no.
not as bad. So same thing, is that more painful here versus here? Okay. Any pain at the outer wrist?
Not as bad.
Not as bad. Still just slightly uncomfortable.
Mm-hmm.
And fingers here. Any pain at the pinky?
No.
Here? No.
It's like so.
A little bit.
No.
Okay. Is it more painful for you to have your hand this position or the other position, or is it the same?
It's about the same.
All right. So let me go ahead and have you keep your hand like that for now. I don't want you to have to do too much switching back and forth. So I'm just going to take a light and have a little bit of a better look. So this is going to allow me to look at the swelling as well as any deviation or abnormality in skin texture, which can sometimes indicate more injury. I'm also going to have a look at the vein distension there, okay? So I'm going to start here. So I'm definitely noting where the swelling starts here. Non-pitted swelling. So swelling is the body's natural reaction to pumping fluid and blood to the area, trying to create a protection barrier there. So it is to be expected. Unfortunately, it can also come with a few issues, as it can pose a risk of infection and occlusion, as well as lack of sensation. So just moving around. I don't notice as much swelling at the hand. It's mostly here isolated to the wrist. Look at the fingers, looking for any signs of discoloration. I'm looking for any paleness, if it looks like there's a lack of color, a lack of blood flow to the fingers. I see pink here, which is a good sign. I'm going to try to do everything positionally. So as you have your hand on this side, I'll complete my test, and then when you flip, we'll repeat. I don't want you to have to keep flipping back and forth. So I'm going to take a couple of measurements here. There's just a little bit of swelling there. Slight distension here as well. So I'm going to try to just slide that underneath there. Good. So just the wrist. Okay. So I'm going to measure prior to having you move. Good. Not noting any disproportion there. Definitely a little bit of swelling here. Okay. All right, so let's start by measuring this angle here. So seven. Okay. All right, let me just reach over here. My apologies. So I'm just going to take note of something here. So the inner elbow. You have a little bit of migrated swelling. And then we were at 13.7 wrist. I'm going to test your temperature variation. So I'm going to start with an area that is seemingly unaffected so we can get a baseline measurement here. So starting off at about 97.1 average. So already quite a bit warmer there. So we're about 98.9 here above the hand. So we're still within normal body temperature, but obviously quite a bit of variation, which is just further indicative of the swelling. Quite a bit warmer there. Okay, so index finger there is definitely showing some signs of swelling as well. Do you notice any tightness of the fingers? You know, sometimes if you have too much salt, you might feel like a little bit of tightness.
Occasionally.
Occasionally. So overall, there is definitely a difference. I wouldn't say it's anything that I think is posing a risk of infection, which is a good sign. So. I am going to do another marker for pain here. Now, at this point, do you feel like you're in so much pain that you need something to help with the pain before I proceed with the examination, or do you think you're okay?
I think I'm okay.
Okay. So if at any point it becomes so painful that you need medication, then we can go ahead and do that and give you a couple minutes before we come back, okay?
Okay.
So just feel free to let me know. So this tool is going to allow me to apply just a little bit of pressure. I will try to be delicate, obviously, so I'm going to start and kind of work my way down. I want you to tell me when you very first start to feel any signs of discomfort.
Okay.
So again, starting at the shoulder is our marker for an affected site here. So no pain here.
Right there.
Just a wash there. And then as we come up the hand, you still feel pain here, here.
Yeah, but it's fading.
So tell me when you no longer feel any pain or discomfort.
Right there.
Good. All right, now similarly, now that we have kind of a generalized area, I'm gonna come around and I want you to kind of help indicate where it starts. So if I start on this side, do you feel pain here?
Very faint.
Very faint, okay. At what point would you say it starts to really hurt?
Like right there.
Okay. And if I come around this way, do you feel pain here?
A little bit.
A little bit, okay. So the medial side is fairly painful through. So we'll say this is our first indicator here. And if we come up, is it painful in this area?
A little, but not as.
Not as much. So would you say it kind of comes over this way?
Mm-hmm.
Can you indicate where, at what point coming up diagonally?
Where it starts or where it ends?
Where it starts. So let's say you feel pain here, but as I come straight up towards your ring finger, it doesn't really hurt. Does it hurt at the middle finger?
Yeah.
Yeah, okay, so you do feel pain here still. A little diagonal, say 3/4 way of the third digit, and most of the wrist is still painful. This just helps me kind of isolate where exactly the pain is coming from, where the injury could be, what parts of your fingers are affected. So pinky appears mostly unaffected. All right. Now, I want to do the mobility very last because that movement is going to make it more uncomfortable. So I'm trying to get everything else out of the way before I have you start moving around and I see how much mobility you still have intact. So the next thing I'm going to do is do a very brief test of your sensory components because you said you were feeling maybe a little bit of loss there. I do think it's due to the swelling and not so much a neurological deficit, but we do need to check. So the first thing I'm going to do is have you identify whether or not you can feel something just very basic. So this is just a Q-tip, and you should feel that this is just a soft sensation. Okay. So I want you to just either nod or indicate verbally that you can in fact feel something. I'm going to start at the shoulder and work my way down, and it'll be varied. So just let me know. Okay. So can you feel this here regularly? Does that feel normal? Normal. Normal. If we come here and here. Normal here. Good. Okay. So completely unaffected area here. Does this sensation feel the same as this? Good. And this as well, it doesn't feel any different. And if we come around, none of that feels any different. Good. Okay. Very good there. And kind of opposite tactile sensation here. So this is not sharp, but pretty distinct. Can you feel that that's sharp?
Yeah.
Okay. Does that feel the same sharpness everywhere? No, less sharp. Doesn't feel dull anywhere.
No.
And you can feel this all here. And this feels the same. Good. Okay. And again, coming around, all feels the same. Yeah. Good. Okay. And for this next one, I'm going to have you extend your other arm as well. So we're parallel here. So I want to make sure that your unaffected side feels exactly the same as your affected. So I'm going to do it at the same time. So this should feel pretty identical. Good. And same. Good. So no difference in sensation there. Very good. So that's a good sign. Obviously we will test on the other side as well, but just initially that is very good. So let me just document quickly here. Bilateral sensation, posterior side is intact, as well as soft dull sensation and sharp. Okay. Okay. So now I'm going to have you flip your hand. Very good. Does that feel okay? All right. So we're just going to essentially repeat everything that we just did. So I'm going to start by taking some measurements. So we have about 1/4 inch of swelling here. And very gently bring this in. Before I touch you anymore, I'm going to test for temperature variation on this side because I do feel quite a bit of warmth comparatively to the other side. So, okay, the gun is not picking it up, but we'll just do That's good. So I do see some distension here. All right. Okay, so let's do our pain assessment here one more time. Okay. So same thing, I'm going to start at the shoulder and work my way down. So you just let me know if and when it becomes painful. So I shouldn't feel any discomfort here.
Right there.
All right. And as we come up the hand, I'll come down first. Do you feel any pain here? Tell me when it becomes painful.
Right there.
That spot here. So we have a smaller margin on this side for sure. We're at about 3.5 inches. The internal. Okay. Now, same thing as far as the outer 2 fingers. So if we're at this margin here, any pain here? In here? In here? So we are right about medial there. Enough for me to see it. To the shoulder. And again, about 3.5 inches there. Okay. Alright. Now, are you able to tell me if the pain on the outer portion of your hand hurts any more or less than the inner portion of your hand?
It hurts. They're about the same.
About the same. Okay. So you have a larger portion of isolated pain on the outside, a smaller portion on the inside. I do feel like our injury kind of is isolated here to the outer thumb area because that's where most of your swelling is lying. So let me just mark down those measurements here quickly. So we had 3.5 inch margin medial to wrist between the second and third digit. Alright. Okay. Now, if you could describe the pain, would you describe it as throbbing, pulsating, achy, dull, sharp, shooting?
I'd say throbbing.
Okay. Do you ever have any sporadic kind of sharp shooting pain, or it's just always throbbing?
It's just throbbing.
It's always throbbing. Okay. Alright. Okay. Same thing here quickly with our sensation. So we've kind of isolated that you don't have any sensory mishaps at the upper forearm there. So I'm going to move down here. So do you feel that this is soft?
Mm-hmm.
Does it feel the same softness everywhere?
Yeah.
So no change in any of the digits. And if I could have you extend your other arm for me. Does this feel about the same?
Mm-hmm.
And no difference here in any of the fingers. Thumb feels exactly the same.
Mm-hmm.
Good. Okay. And you can tell that this is sharp.
Yes.
Same sharpness. Good. And you can feel me touching your hair.
Yes.
Okay, so I would say that your sensory function is intact. I think any mild lack or loss of sensation that you're having is really probably just due to the swelling, which could come and go as the swelling kind of increases and decreases with ice. Also, as well as if you ice your hand, obviously you're going to be a little bit numb. So that's okay. I'm not too concerned that it's affecting you neurologically or your ability to sense anything. Okay. So now we are going to move on to the portion where I have you kind of manipulate a little bit. I'm going to take some measurements of what your mobility level is now, and then when I have you come back in for a follow-up, we will retake those measurements and see what has changed. Okay? So as we do this, I'm going to ask you what your pain level changes to, that way I don't have to keep having you move it up and down. So I want you to bend as far as you can at the elbow, bring your wrist in. Is that painful at all?
No.
Okay. So as far as you can extend there, I'm going to go ahead and take a measurement. So that's very good. Okay. All right. And then very gently, just to the point where it becomes uncomfortable, how far can you bend your wrist?
Right there.
Okay, so definitely slightly diminish there. We're not getting 119 degrees. Right. And if we just bring fingers up here, is that painful?
No.
No. Okay. Right. Okay. And are you able to bend at the middle hand, or is that just at the fingers? Is that as far as you can extend? Does that hurt at all?
It doesn't until I bring like my
Until
thumb
you bring
in.
your thumb. Okay, so until you try to extend your thumb, then it's okay. All right, so keep your hand just like that for me. I'm just gonna take a note here. We are 155. Okay. And then can you stretch your fingers and lie them flat? Does that hurt at all? No? Okay. And then if you separate here, any pain there?
Just in the thumb.
Just in the thumb. Okay. Here we are. 136 there. All right. If you bring your fingers together like this, pain in the thumb as well?
Mhm.
Okay. I'm going to hold your forearm here. Are you able to rotate your wrists like this at all? Does that hurt?
Little bit.
Okay. Does it hurt more to go out towards the thumb or in towards the pinky?
And towards the pinky.
Okay, so that extension is definitely inhibited there. Okay. All right. So lastly, for mobility, I'm going to place my hand here gently under your forearm and just kind of carry the weight of your hand. I want you to attempt to just completely rotate your wrist if possible. Okay, so you are able to rotate. How much more pain would you say that causes? So if we're at a 4 at baseline,
Went to like a 6 or 7.
6 or 7. Okay. All right. So definitely diminished mobility, rotation. I'd say your flexion was actually intact. Extension though was slightly diminished. Okay. And at the onset of injury, do you remember how painful it was in the very beginning? Was the initial pain level like a 10 or?
No, I
No, I don't remember. It's okay. Oftentimes we just kind of block it out because it's not a memorable experience, so that's totally understandable. Has the pain ever woken you up out of your sleep?
No.
Do you find that you're having to position yourself a certain way to go to sleep, or
Yeah.
Okay. Okay. All right, Samantha. So I am going to do one final test here. This is just a regular physical therapy putty. It's a little cumbersome to get out of the container. I'm going to hand this to you, and I want you to attempt to just squeeze it as much as you can. So as much as you can without causing too much discomfort there. So
Like about there.
okay. So what we will do is set this. So now that it's been exposed to air, it will set and dry. And then when we have you come in and retest, I will have a new one and we will compare the two and see. So it's just another indicator of if there's any changes here. So I'm going to allow this to just air dry as is. And I think at this point my recommendation is going to be that we go ahead and give you a cast. So what I'm going to do, if you're okay with it of course, is a temporary cast. So it's a wet cast. I'm going to apply some strips. They don't have water on them. It'll get hard. It is similar to a permanent cast, but it's not going to be as hard, so you have just a little bit more mobility. You still can't get it wet in the shower. So at this point I would say we should keep it on for about 7 days. I'll have you back in and then we'll take it off and reassess, and then should we need to put it back on, we can. This looks to me more as a minor to moderate sprain of the wrist, specifically of the thumb. So I would say 7 days should be okay, as long as you're keeping up with your adequate care, keeping it still and not overextending. Okay. All right. So give me just a couple minutes to get all of that prepared. I have to cut the strips and obviously cleanse your arm, and then we'll proceed.
Okay.
So just a little bit here.